For years, people have Googled their symptoms, often scaring themselves half to death. Now something far more powerful has arrived: AI chatbots that can hold a real conversation about your health, coach you on your habits, and offer eerily doctor-like answers about your symptoms. Tools built on the same technology as ChatGPT are being aimed squarely at healthcare. It's genuinely impressive, and genuinely risky. In this episode, we'll look at AI health coaches and symptom checkers, what they're surprisingly good at, where they're dangerous, and how to use them without getting hurt. Let's separate two things that often get lumped together, because they carry very different levels of risk. The first is the AI health coach. This is AI used for guidance, education, and motivation, answering your questions in plain language, explaining what a diagnosis or a medication means, helping you plan healthier habits, or talking you through general wellness. The large language models behind tools like ChatGPT, from companies like OpenAI, turn out to be remarkably good at this kind of patient, clear, judgment-free explanation. The second, and much riskier, tool is the AI symptom checker. This tries to do something genuinely hard: take the symptoms you describe, interpret them, and tell you what might be wrong and what you should do: see a doctor, go to the ER, or stay home. That's edging into the work of diagnosis, and that's where both the promise and the danger get much bigger. Same underlying technology, very different stakes. Let's give AI real credit, because in some ways it's genuinely excellent. As a health explainer, it can be outstanding. It translates dense medical jargon into plain, understandable language. It answers your follow-up questions patiently, at 2 a.m, without making you feel stupid for asking. It can help someone facing a scary diagnosis understand what it means and what questions to bring to their doctor, which is empowering and calming. In fact, several studies have found that AI answers to common health questions are frequently accurate, and strikingly, that people often rate them as more empathetic and thorough than the rushed replies they get from busy human doctors. That's a remarkable and slightly uncomfortable finding. So for understanding your health, preparing for appointments, and getting clear explanations, AI can be a genuinely valuable companion, a tireless, knowledgeable, and surprisingly kind explainer. Now the dangers, and they are serious, because the very fluency that makes AI impressive is also what makes it risky. The core problem is that AI can be confidently, convincingly wrong. These systems sometimes hallucinate, they generate false information that sounds completely authoritative. In casual use that's annoying; in health, it can be harmful. An AI might reassure you that your symptoms are nothing when they're actually a warning sign, or send you into a spiral of panic over something benign. And it has fundamental blind spots a doctor doesn't. It can't physically examine you, it can't run a test, it can't see the subtle signs an experienced clinician notices, and it doesn't truly know your medical history, your medications, or your risks unless you happen to tell it. It has no real accountability if it's wrong. So the cardinal sin is treating an AI symptom checker as a diagnosis. Both of its failure modes are dangerous: false reassurance that stops you seeking care you need, and false alarm that causes needless fear. It is not a doctor, however much it sounds like one. So how do you get the benefit without the harm? The rule is simple and worth remembering: use AI to understand, not to diagnose. Lean on it for what it's genuinely great at: explaining a condition, translating your lab results into plain English, helping you prepare a list of smart questions for your doctor, and offering general, well-established health information. That's real, safe value. But draw a hard line at letting it decide what's wrong with you or whether you need care. Never let a soothing AI answer talk you out of getting real symptoms checked, and never let a scary one send you into panic without a human sanity check. If something feels genuinely wrong, or the AI raises anything worrying, a qualified human clinician makes the call, full stop. Think of AI as an incredibly well-read, endlessly patient friend who happens to know a lot about medicine, wonderful for understanding and support, but not the one who examines you, orders the test, or signs off on your care. Used that way, it's a powerful ally. This is educational, not medical advice.